graduation in otorhinolaryngology. I take this opportunity to welcome you all to the first of its kind summer intensive training workshop in clinical assessment of voice disorders, scheduled as a part of the upcoming World Voice Day on the 16th of April 2022. I request all of you to make use of this opportunity to learn and be equipped to effectively diagnose voice disorders. Now I request Dr. Vijayalakshmi Subramaniam, Professor and Head of the Department of Otorhinolaryngology, to deliver the welcome address. Thank you.
Thank you, Aishwarya. Am I audible?
Yes, ma'am.
Okay. So, good afternoon, everyone. It is a great pleasure for me to welcome you all for this summer intensive training workshop on the clinical assessment of voice disorders, which has been organized, and actually a lot of effort has gone into putting together this workshop by the Department of Otorhinolaryngology and the Department of Audiology and Speech Language Pathology of Yenepoya Medical College, Yenepoya deemed to be University, Mangalore. And it is a matter of privilege that we have a wide array of distinguished speakers who are going to give us expert insights in the clinical assessment of voice disorders during this workshop, and we are all going to be learning together from each one of them. The idea behind this workshop is to bridge the gap between the various stakeholders, that is the medical practitioners, the speech language pathologists, the researchers, and the engineers, so that we can all work together in the direction of comprehensive and evidence-based practice in the diagnosis and management of voice disorders. So we hope that we will be able to transfer the clinical skills of voice assessment using acoustic analysis and the various laryngeal examination tools which we often use in the diagnosis and management of voice disorders. As of date, acoustic analysis continues to remain the cornerstones in both clinical and the scientific methods of voice assessment, regardless of what the voice problem is. And there is definitely a need for all professionals involved in the diagnosis and management of voice disorders to equip themselves with better understanding of the various software tools that are available for acoustic analysis of voice and speech. We hope that this workshop will give all the participants theoretical insights as well as practical inputs over acoustic voice assessment using various tools and software. So we are going to have a series of presentations, demonstrations, interpretational exercises by various resource people, which will be involving all of you, and we will have discussions thereafter. So it is my pleasure and privilege once again to welcome all our resource persons. So I welcome Dr. Mahadev Prasanna, who is the keynote speaker for the day. He's professor and Dean, Research and Development at the Indian Institute of Technology, Dharwad, Karnataka. We will also be having Dr. Ajish K. Abraham, who is the professor and head in the Department of Electronics, All India Institute of Speech and Hearing, Mysore. It is my pleasure to welcome Dr. Ajish. I will also take this opportunity to welcome our other speakers. Dr. T.V. Ananta Padmanabhan, who's the founder and director of Vagmi Voice and Speech Systems, Bangalore, the pioneer behind the Vagmi software that we all use so extensively during our voice assessments. Dr. Narasimhan S.V., Associate Professor and Head, Department of Speech Language Pathology, JSS Institute of Speech and Hearing, Mysore. Dr. Gopi Shankar, who is the Research Officer, Department of Clinical Services at the All India Institute of Speech and Hearing, Mysore. Mr. Prasanna Hegde, who is the Program Director and Clinical Lead in Diglotology and Speech Language Pathology in the Department of Head and Neck Surgery at the HCG hospitals in Bangalore. Dr. Neetika Sharma, who is the Product Manager for India and South Asia for the Pentax Medical Systems, New Delhi. And Ms. Sindhusha Chandran, who is a speech language pathologist in the Department of Plastic Surgery at Jipmer, Puducherry. Am I audible? Someone has messaged that there's no audio.
Yes, ma'am.
Okay, I think then it's a problem for that person. So apart from this, we will also have Dr. Deekshit RM, who is a faculty of our own department, the Department of Otorhinolaryngology, Yenepoya Medical College, Mangalore. I also welcome the Associate Professor and in charge Head of Department of Audiology, Speech Language Pathology, Mrs. Shweta Prabhu, of course, who's a very nice colleague to work with for me. And it's really a pleasure to have her. It is also a great pleasure for me to welcome all the delegates who have registered in large numbers for this workshop. I hope all of you will have a fruitful learning experience over the next 3 days. And I take this opportunity to also greet you all on the occasion of World Voice Day 2022. Thank you very much. Over to Dr. Aishwarya.
Thank you, ma'am. Today's schedule comprises of a keynote speech by Dr. Mahadeva Prasanna on the significance of artificial intelligence and machine learning for voice pathology. This will be followed by clinical interpretation and vital keys to note in laryngeal examination by Dr. Vijay Lakshmi Subramaniam, and a session by Dr. Ajish K. Abraham on clinical voice assessment in the role of acoustic methods, criteria for high quality video or speech recordings in the clinic, calibration and reliability and validity of acoustic measures. Moving on to today's agenda. We are honored to have Dr. S.R. Mahadeva Prasanna, Professor, Department of Electrical Engineering, to deliver the keynote speech. Dr. S.R. Mahadeva Prasanna, a distinguished professor from the Indian Institute of Technology, Dharwad, Karnataka, a proud alumni of the National Institute of Technology in Surathkal, and having a doctorate degree from IIT Madras, has accepted our request to deliver the keynote speech. He has guided more than 31 doctoral studies and continues the mentorship in the directions of innovation and technology incubation. He has more than 354 research projects, publications at national and international level, with an overall citation of 4,989, NH index of 36, and an I-10 index of 128. Sir has contributed significantly to the field. His research interests include speech and handwriting processing, applications of signal processing and pattern recognition, applications of artificial intelligence, machine learning, and deep learning. His teaching interests are signals and systems, signal processing, probability and random processes, data analytics, pattern recognition and machine learning, neural networks and deep learning, and speech processing. Dr. S.R. Mahadeva Prasanna is currently working as professor in the Department of Electrical Engineering and simultaneously handling the administrative functions as Dean of Faculty Welfare and Dean of Research and Development at IIT Dharwad. Now I request Dr. S.R. Mahadeva Prasanna to deliver the keynote speech. Over to you.
Yeah, thank you, Dr. Aishwarya. Thank you for that nice introduction. Thank you all for making this possible and giving me an opportunity, especially Hemraj for contacting me and requesting for this talk. It's always a pleasure to talk about speech processing, and of course, I don't really work in the speech and language pathology and those directions. We work mainly from speech signal processing point of view. So when I thought I'll share some of our recent thoughts in the last 1 decade about what is happening in the technology arena of speech processing area. Is my slide visible, Dr. Aishwarya?
Yes, sir.
Yeah, thank you. So I have put my thoughts under this title to outline the significance of artificial intelligence and machine learning for the voice pathology field. Of course, you might have heard about these buzzwords like artificial intelligence and machine learning, which are making a lot of headlines in the last 1 decade, not only in the field of technology and voice pathology, in general, the whole medical field and other areas of applications also. So my focus will be just to explain more about these terminologies, what do they mean, and how currently these concepts are being used in the field of voice pathology. That concepts being used in voice pathology will be only a small part of my discussion or presentation, but majority of them will be to introduce you to the field of artificial intelligence and machine learning. In that, my focus will be to emphasize why this field of artificial intelligence and machine learning has caught the attention of research community and technology development community from varied fields, starting from electrical engineering to computer science to civil engineering, medical field, and all other, even scientific fields also nowadays talk about using artificial intelligence and machine learning. Organization of my presentation is in the following way. I will introduce the field of artificial intelligence and machine learning. I will talk about the terminologies that we use extensively in the field of artificial intelligence and machine learning. Even though we use these terminologies like machine learning and deep learning, but from the basic understanding, there is a distinction between what we call it as machine learning and what we call it as deep learning. Even though we may use them interchangeably, I would like to explain the difference between machine learning and deep learning. And I'll briefly mention about some of the machine learning models, also about some of the deep learning models, and how these deep learning models are being used currently in different applications. And just briefly touch upon how some of the attempts have been made for using the machine learning in the voice pathology detection field. Then I'll summarize my presentation. When I come to the field of this artificial intelligence and machine learning, we use these 4 terminologies frequently. One is the artificial intelligence itself. Next one, what is called as pattern recognition. Before the machine learning terminology became very what we call prevalent in the field of artificial intelligence, we had this terminology called pattern recognition. And after this machine learning came into the field, there is a special version of the machine learning, what we call it as deep learning. Of course, currently, we use these terminologies interchangeably in the literature. However, there is a specific motivation for coining these terminologies. For example, when I come to the field of artificial intelligence, this terminology was introduced long back, maybe at least 4 decades back, when the computer scientists or computer engineers wanted to develop capabilities for the computing machines to perform some of the intelligent tasks that humans do on a daily basis, to mimic them on a computing machine. For example, the speech production, speech perception, speech mode of communication. This is one good example for intelligent tasks that humans do on a daily basis. Can I enable computing machines to understand what we speak, and also it can respond back in the output in the form of speech signal, and it can perform other tasks by interpreting the different information that are there in the speech signal. That was the dream that led the researchers working in the field of computing to come up with this field of artificial intelligence. Of course, as I will be explaining in the next slide, the concept of intelligence associated with humans is a phenomenon which is directly linked to the cognitive process that we are all endowed with. Since computing machine is just a digital electronic circuitry and does not have anything related to the cognitive process, that is why what we are trying to do on a computing machine or in the computing field is only to mimic these intelligent activities on a computing machine. That is why the prefix artificial came into picture. That is, when we are trying to mimic these intelligent activities on a computing machine, the whole gamut of approaches that have been developed for the last 4 decades are grouped under this field of what we call artificial intelligence. Of course, when we consider that, there is no equivalence between the human intelligence and the artificial intelligence. We only mimic the way humans do this intelligent activity. We try to mimic. May not be in the exact fashion, but only the input-output should reflect what humans do. And when they started this field of research in the computing, that is the field of artificial intelligence, they discovered one important aspect in human way of dealing with external world as compared to the way computers deal with the external world. When I take computing machines, which can be starting from your smartphone to the highest supercomputer, the way they do is they need everything in the form of data, and for it is just crunching this data to derive some inference out of that. Whereas when we come to humans, that is how humans have been evolved in nature. With all our perception, sensory organs we are associated with, whatever we do, that is how our cognitive systems has evolved in the nature, that whatever we do, if I want to interact with the external world, that is, receive information from the external world, or the way I generate information to the external world and also interact with the external world, it is in the form of what we call it as a pattern. It is not in the form of a data. For example, if I listen to a speech signal of a known friend or a known colleague, even if that colleague says a simple word like hello, I am able to recognize that person from the word spoken by him or her. What it indicates is there is a specific unique feature associated with that person's speech production system, which enables me to attach a particular person to the speech signal that I am listening to. And that is what is called a pattern. Similarly, when I look into the facial images of a known personality, I will be quickly able to recognize, okay, he is that person. Okay, and that is what is called a pattern. The distinction between pattern and data is the patterns are which are very what we call redundant, will have a lot of redundant information, and also will be able to tolerate the distortions that happens in the external world. For example, even if I'm listening to the speech signal of my friend sitting across the table or through a mobile channel, even though suppose if the person is talking from a very noisy place like a railway station, and I'm listening to the speech signal, even though I feel that the incoming signal is noisy, but still I'm able to make out he is that friend. And this capability for human cognition is happening because what we use is not, we don't process data, we process patterns. Our cognitive system processes patterns. That is where, when this fundamental distinction was observed, the field of artificial intelligence researcher felt that for the computing field, we can bring this concept of pattern recognition. That is, you give additional capability for the computers to process everything in the form of patterns. And that is where the term called pattern recognition came into field. Suppose if I'm doing, for example, speech recognition by a computer or speech generation by a computer, which we more commonly term it as speech synthesis, or speech pathology analysis, analysis and recognition, that is a pattern recognition task that we do it on a computing machine. So that is where the field of pattern recognition came. Then there is something called machine learning evolved in the early 90s, which as a next level of advancement in the field of pattern recognition. Again, here also I would like to clarify, when I say the word learning, that learning is associated with the human cognition. Here also, the computing machines do not have anything related to cognition. So accordingly, from that point of view, this word machine learning is a misnomer. However, since it has used so in a widespread manner, people are comfortable using this terminology. But from a real neuroscience person, there is nothing cognition here. So accordingly, the learning term is a misnomer here. However, from a technology point of view, we use that machine learning. Again, here also it is like artificial intelligence. We know humans, we learn from different experiences and use that learning to survive in this world. And that whole learning happens in the cognitive system. And that learning will lead to storing the knowledge from that experience or impressions that we have and use that knowledge at a later point of time. They wanted to mimic this activity on a computing machine. That is, machine also will exhibit the process of, mimic the process of learning. And that is why it is called as machine learning. So the goal here is, suppose you are giving a set of data points or features, say from the speech signal or facial images or any other external data you are getting to the computing machine. As humans, suppose if I take speech signal, somebody records a speech signal on a computing machine or a computer. Using an audio editing software or audio playing software, you can play that speech signal. When you play that speech signal, our auditory perception system listens to it and discovers different information sources. And that is the human way of pattern processing. Whereas if I just open a file where this speech signal has been stored in the form of sequence of ASCII numbers, just by looking at the file numbers, I will not be able to make out what is that information stored in the sequence of numbers. When you play it and listen through your auditory perception system, then only you can discover the underlying patterns that are present. Patterns means what is the sound sequence of sound that have been generated, and what are the spoken words are present, who is that person, what is the language in which that person is speaking, what is the emotion associated with the person, and so on, gender and many other information sources. Each of them can be treated as a pattern, and that can be discovered by our auditory perception system, of course, under the guidance of the cognitive system. Can we enable computers to automatically discover that underlying patterns without specific guidance in the form of algorithms? In the form of algorithms means what exactly, we don't give any prescription in terms of how a pattern looks like. Okay, it will automatically discover what is the pattern that is present. That is what, as humans, we do it. For example, when I recognize humans by looking into their faces, our cognitive system does not apply the same way of focus to learn the uniqueness of face of a particular person. By that I mean, suppose I'm looking into the face of my friend, my cognitive system may employ a different process for identifying the uniqueness associated with that person, which enables me to recognize that person even when the person's face is not completely visible, maybe a partial occlusion is there. For that matter, let us take the speech signal itself. When I take speech signal, when I'm trying to identify a particular person with her speech signal, maybe her speech signal is melodious, or speech signal may be very nasalized, or a speech signal may be creaky. There is something. No, like that, each person will have a unique feature. Of course, these are some broad things I mentioned, but with the time, which is difficult to discover or give in a descriptive manner what exactly our cognitive system exploits to get that uniqueness, but we are all witness to that we can uniquely identify the people. It automatically learns with the time the distinctions for each of the patterns. And that is what is that ability we want to give a computing machine. And that is what is called as the machine learning. Then of late, in the last 1 decade, as a specialized version of the machine learning, we have this field what is called deep learning. When it comes to the deep learning, suppose when I go to the machine learning, we assume that, suppose if I take the speech signal, I process the speech signal through a relevant feature extraction algorithm, and those extracted features, I call them as data points and use those data points for doing machine learning. That is the assumption in the case of machine learning. Whereas when I go for deep learning, I take the raw speech signal, that is the sequence of digital samples of the speech signal, and apply it to a learning model, which means, please note the difference, I don't extract the features. I apply the raw sequence of speech samples as input to the learning model, and the learning model will first extract the relevant representations, which are equivalent to the features, which we do it explicitly by speech signal processing method. In place of that, we learn the representations and then use those representations in the further levels of that model to discover the underlying patterns. So in that way, it will combine both speech signal processing for feature extraction as well as the pattern discovery of the machine learning together in one model. That's why it is called as a deep learning model. From the raw data, several hierarchical layers will be there. First, we discover the underlying representations, that is features, and then use those features in the later layers to discover the patterns from the raw data speech signal samples given. And that is why the name deep learning has come. Starting from the raw data, we can discover the patterns and then discover the representations or features, and then using those representations, you discover the patterns. So this is how the concept of deep learning has come into field. So now, even though we in the literature we use these terms interchangeably now, but there is a specific motivation or reason for which these terminologies have been coined in the literature. Even though we also may be using in the later slides these terminologies in a interchangeable manner, but there is a specific distinction between these terminologies, artificial. Then another distinction I wanted to mention here, when I take the field of pattern recognition, that field refers to all those approaches that will try to recognize patterns from the given data points. Of course, machine learning, the goal of machine learning is discover the underlying patterns without being explicitly programming that this will be the shape of the pattern you look for. So in that way, machine learning techniques can be used for pattern recognition, but all pattern recognition techniques need not follow machine learning. There can be simple template matching, fixed to template matching approaches also for pattern recognition. However, nowadays, mostly people use this machine learning for pattern recognition purpose. So these are the terminologies that we are using in the field of artificial intelligence and machine learning. So this I have mentioned. Suppose when I go for the artificial intelligence field, if you see the dictionary meaning of the word intelligence, we use our experience and then to get a set of impressions, that is ability to learn and understand, and then use these impressions for deciding the future course of action. Suppose if I go for human intelligence, we should not confuse with the academic performance of a person to the concept of human intelligence. It is essentially to say, as humans, all of us are endowed with the intelligence capability. That is why we are able to survive and interact with the external world. Coming to the artificial intelligence, we are enabling the machines to do this intelligent task. What is that? Computing machines also will have approaches which can discover, learn, deal with uncertainties and new situations. That is the capabilities of the artificial. Of course, when 3-4 decades back, when the field of artificial intelligence was introduced in the computing arena, that was referring more for symbolic manipulation. Because before the symbolic manipulation, computers were mainly meant for data processing. They introduced this concept of symbolic manipulation. That is, you can change the course of action based on symbolic manipulation. For example, if some of you have exposure to the programming, for example, if then else or no, if some result of some process is yes or no, based on that you take the next course of action. There is no data there, it is a simple manipulation. Or if that value is greater than that or less than that, that is how the symbolic manipulation was there. Whereas now when we call about the artificial intelligence, we are talking about what we call the connectionist approach, which is essentially learning models are there, which mimic the process of discovery, learning, dealing with uncertainties and new situations. That is what we call as artificial intelligence nowadays. Pattern recognition, as I told, it is model and recognize patterns. What we do is, which is mimic the human way of dealing with external world through cognitive sensing and processing. So we do the sensing, then do the feature selection, then using the features, do the model creation, and then use this model for comparison for the new set of features coming, and then find out what is the pattern present in the given data at a point of time. At that point, what we demonstrated was it is indeed possible to do pattern recognition on a computing machine. We just conceptually mimicked human way of dealing with natural data. Whereas when we come to the machine learning, what we call is the automatic task of automatic discovery and learning of patterns, both from natural and synthetic data. That was the way the direction was projected. Of course, there was not much focus on feature extraction. We assume that suppose if I consider speech processing pattern machine learning for speech processing, we are talking about the feature extraction is done by speech signal processing methods as a standard block, and then use those features as data points for pattern recognition process. And the more emphasis was given on discovery and learning of patterns by machines. Now develop new methods which can automatically extract the patterns from the data. Of course, mathematically, we represent it as, suppose if X is the set of data points or features given, Y is the pattern information. We assume that there is a functional relationship exists between the input data features and the output class labels. And you discover and learn the functional mapping by the machine learning approach. That is how the concept of machine learning was simplified in the engineering field to come up with the different methods for this functional function learning. Coming to the deep learning, as I mentioned earlier, you learn both the features from the raw data, that is representation, and then use these representations for discovering the patterns. This is the distinction here is we are trying to mimic the human way of learning. That is, we learn from experience. When I'm learning any thing, suppose I'm a novice, I'm trying to get the mastery over certain process. So on the first day, I'm a novice. When I'm taking coaching or start getting mentoring from the mentors, on the first day as I'm novice, it is not possible for me to learn everything in one day. Even the mentors or teachers also know this well. What they do is they will not mention all the things on the first day. They will not specify everything in the beginning. Okay? They will place everything in the hierarchy of concepts. First, they will try to teach you with simpler concepts. And once they observe that you have got hold on to that simpler concept, then they will introduce next level of difficult concept, where these difficult concepts can be expressed in terms of the simpler concept that you have learned. Then the difficult concepts can be further combined to get more complex concepts. So in that way, understanding or learning from experience is in terms of hierarchy of concepts. Okay, each concept is defined in terms of its relation to simpler concepts. So in that way, learning complicated concepts out of the simpler ones. And the way the deep learning models have been evolved in the literature or computing field is also like that, where you are given raw data. From the raw data, first learn these simpler representations and then use these representations for pattern discovery. That is the field of deep learning. Of course, pictorially, this is taken from a public domain. If I want to distinguish between traditional machine learning and deep learning, in the traditional machine learning, what we do is you take the raw input, speech signal to the computing machine, and a speech signal processing person will invest a lot of time from the domain knowledge and come up with algorithms to extract relevant features. That is how these features will be extracted, and use these features in the machine learning models for building systems which can distinguish between different classes. So this is the pipeline for a machine learning purpose. Whereas when I go for deep learning, this feature engineering and getting handcrafted features and building the models, everything is combined into one model, which we call it as a deep learning model. So you apply raw input as to that model, and the classified output comes at the output of the deep learning model. So that is the distinction between machine learning and deep learning. Of course, this job has made, so unless you have a domain knowledge, you cannot come up with the best set of features. So accordingly, the performance of the classification system may not be very great. Alternatively, if I go for deep learning, it will do everything for me. Apply raw data, and then it gives me the classification. Of course, it looks very simple. However, what is the price we are paying for this is, you need a large amount of data to really exploit the potential of the deep learning model. For example, just suppose if you need 1,000 examples to build a reasonably good performance machine learning model for voice pathology, whereas in case of deep learning, you may need at least 10,000 samples. 1,000 examples in the machine learning. If you want to really exploit the potential of the deep learning, you should have at least 10 times of that data or 100 times of that data. 10,000 examples are required to really exploit the potential of the deep learning. Otherwise, the performance of the deep learning model will be comparable or even inferior in some cases compared to the machine learning. That is the price we are paying. You have more data, then deep learning models are the way to go about. Just to pictorially another model which has extracted. So this is nothing to worry about this pictorial representation. Assume that this is a machine learning model. Raw input data is there. Feature extraction is done by the human expert using different approaches. Just a computer I can use and get the features. Then I apply these features to the deep machine learning model to get the classification. Whereas when I go for deep learning, there is no human intervention. Directly you apply the raw input, and the model processes and gives me the classification. The same way here also. For example, if I'm doing a face recognition, automatic face recognition on a computing machine, earlier when we had a machine learning model with shallow neural networks, what we used to do is we extract the features and apply the features to the neural networks model. Shallow neural network is a machine learning model. And those features extracted from the facial images are applied to this shallow neural networks to come up with the face recognition task. Whereas when I come for deep learning, I apply the facial image directly as pixel values to the deep learning model. In case of speech, I apply directly the sequence of samples to the speech signal, and recognize that a face comes as the output, or recognize that a pattern comes as the output. For example, if you see pictorially, if you want to see how this process happens in the deep learning, a facial image is nothing but a pixel. If you consider a gray level image, it is white and black, different gray level image pixels, and that is passed through the deep learning model. The first layer will learn some edge information, and this edge information is combination of edges, get some shapes and a bigger level facial space, and finally you get the different face images as the output layer thing. So this is how the deep learning distinction happens when compared to the conventional machine. If you see, if I want to put all of them together, the bigger picture is, it's a broader field that is artificial intelligence, and in that, what we are talking about, machine learning is a subfield in the artificial intelligence. And in that machine learning, one of the major direction we use is what we call artificial neural networks. And in that neural network, specialized networks are there, what are called as deep learning models. So this is how I can relate neural networks and artificial intelligence, including the deep learning models. Okay. So this is the basic distinction between artificial intelligence and machine learning. Maybe if another 15 minutes I may have. Okay, this is about the explanation with reference to starting from the field of artificial intelligence to the deep learning. Now let me list out some of the machine learning techniques that we use extensively in the speech processing field. For example, we do clustering of the features. We can use K-means clustering, fuzzy C-means clustering, or any other clustering technique. We use dynamic time warping to match two temporal sequences of different lengths. We use Gaussian mixture models as modeling techniques, machine learning modeling. All of them are machine learning. Machine learning means I am assuming that you are not giving the raw data as input to these models. you have a speech signal processing feature extraction method. And using that feature extraction method, first to extract the features and then use any of these models, like Gaussian mixture models, or Eden-Markov models, or neural network models, shallow neural network models, support vector machine, K nearest neighbor, random forest, Bayesian learning. Don't have to worry about these terminologies. There are a plethora of machine learning models which can be used for building classification models. Similarly, when I come to the deep learning, we have deep feed-forward neural network, we have deep belief networks, deep autoencoders, we have generative adversarial network, convolutional neural networks, time delay neural networks, recurrent neural network, long short-term memory transformers, and so many deep learning models are. Here, the commonality among all these deep learning models, maybe their working principles may be different, but their input and output process is same. You apply the raw data as input and collect the classification as the output as the output. Okay, that is the commonality. Their difference compared to the machine learning is, here we apply raw data, there we apply the features extracted from the speech signal processing method. As I told, the important thing is we need exponentially more data in the case of deep learning models compared to the machine learning. So depending on why I'm emphasizing on this point is, it depends on how much data you have. For example, if it is difficult to collect more data points or more data from any particular task, and the number of classes are limited, it is still okay to go with the machine learning models. Machine learning models, whatever I have listed in the previous. Whereas you have large amount of data and you also are undecided about, you're not sure about which features to extract, then it is good to go with the deep learning models. For example, if I consider some of the deep learning architectures, one of the well-known neural networks in the deep learning area is called convolutional neural networks, where we can extract the features from the deep learning. You apply the raw data, these convolutional layers which are there in the deep learning model, they process that raw data, and by nonlinear processing, they get the features. For example, our human cognitive system also, if you take the biological neurons, which when we mimic on a computing machine, we assume there is a nonlinear output function. So that nonlinear way of combining the evidences and coming up with some set of representations, and that we mimic on a deep learning model to extract the relevant features. So accordingly, you can use the features and then use later layers of the convolutional network to do the classification output. Similarly, suppose I want to reduce the dimension of the vector. You have a large dimension vector and you want to reduce it. You can use autoencoder, we call. It essentially, pictorially, the architecture looks like this. So you apply the large dimension vector to the input, and in the center of the network, what we call it is a bottleneck layer. It is a very large, small dimension vector. Maybe if it is 1000 dimension, you can bring it down to 100 dimension. And the beauty of that is this 100 dimension vector also will capture almost all the information what is there in the input large dimension vector. However, whatever the redundancy was there, it has neglected. Okay, so that is how this bottleneck layer will function. Similarly, there is something called another model called variational autoencoder, which essentially captures the distribution of the underlying patterns that are there in the data. So, of course, these are a slightly higher level concept, but what I wanted to, just as an exposure, I want to mention these points that there are different explorations that have been done, different models have been put forward in the deep learning, which enables you to discover some things which were not possible earlier. So, even there is something called generative adversarial network. The beauty of this network is, even though, suppose, if I want to generate new speech signals without any seed points, for example, on a computing machine, unless you have stored the speech waveforms and then use them for seeding, developing a new speech signal, that is what we had seen earlier. But now, it is indeed possible for a computer to generate the speech signal without taking any clues about what is that nature of the speech signal. But of course, during the training process, indirectly it learns the speech production process. Once it learns, during practical usage, it can generate speech signals which are indistinguishable compared to the human speech. So that is the power of these deep learning models. Similarly, I can use this, again, classification purpose, I can use these deep learning models. Coming to the aspect of voice pathology, of course, recently there are a lot of works that are done to do voice pathology detection using machine learning. When I say machine learning, now I am using both machine learning models as well as the deep learning models. Okay. What is people have proposed, at least in some of the articles that I referred to from an engineering field, these machine learning techniques are considered to be very promising tools in the detection of voice pathologies. That means to say, I can develop a voice pathology detection system using any of the machine learning approaches. What this machine learning system will do is, it can classify the voice signal, say, into healthy versus pathological speech. And you can have a finer distinction, even in the pathological condition. If you are looking for different grades of pathology, you can indeed build such a system. Now, the beauty of such a system is, of course, human expert is the best judge. Okay, from their experience, they can judge on what is the type of voice pathology we have. If you want to get a second opinion, an unbiased opinion from a computing, you can use a computing machine, ML-based approach. You feed that data to that ML model, it will give you a secondary opinion along with your expertise. That will now reinforce your whatever you are trying to predict once you listen to the speech signal. Of course, how do we build that ML model? Suppose if I go for a traditional ML process, I extract features. One of the well-known features is what we call Mel frequency capsular coefficients. We extract from the voice samples or the speech signal, for example, for vowel R, and build the ML model using Gaussian mixture model or a support vector machine array, which can be built for a binary classification task. For example, I just want to see if it's a healthy subject or a pathological subject. That is the simplest task, binary class I want to do. You collect the voice samples from the normal or healthy subjects and the pathological subjects, extract the features, and then you build the ML models to perform this binary classification task. That is, you expose this model for both healthy subjects data as well as pathological subjects data, and use that knowledge to distinguish between the two models. So that way you can build. Now what happens is, now assume that as a human subject, as an expert, when you are doing this, you will listen to the speech signal of the subject. Based on that, you mention what is that particular, whether it's a healthy subject or pathological case, or what pathological means, what is the gradation of that pathology. Now you have trained the ML model, you can feed the data to that system. You don't have to have a physical device here. You just record the speech data, put into that algorithm on a computing machine, which will be able to tell you, display you the results. It can generate the result, a report, which you can use it as an additional evidence. So the main function of this ML algorithms will be to evaluate and recognize the voice disorder. Okay, build a system it able to deal with acoustic pathologies, differentiate the pathological voices from the healthy voices. As I told, there are many classifiers like support vector machine, Gaussian mixture models, deep learning models in that convolutional network, which you can use any of these models depending on what task you are doing, how much data you have. So based on that, we can make a choice of one of these models and feature extraction methods and build a model for that. As a final remark, I want to mention this. You can, when I want to do a voice pathology task, I need to collect the speech database. Okay. And whether I want to go by traditional machine learning based approach, or I would like to go by the deep learning based methods, it depends on how much data you have. You have large amount of speech data and you are not sure of what feature to extract, or the feature extraction method that you're using is not giving the expected results, then you can go for a deep learning based method. Alternatively, you have relatively less amount of data, but you know exactly what type of features you can extract using speech signal processing method. Then you can go for an ML based classification model. So in that way, there are documented and useful speech signal processing methods are there in the literature to extract relevant features from the speech signal. Similarly, there are well-documented machine learning models like support vector machine, Gaussian mixture models, shallow neural networks. They are all there in the literature. Similarly, deep learning models are there, plethora of deep learning models are there. And using these, we will be able to develop very good voice pathology detection systems, which gives very good results compared to any physical systems that you have in the laboratory on a computing machine. Only the reliability or the performance of such system depends on what type of speech data that you have collected. You have enough number of pathological cases. Of course, healthy subjects, you will be able to collect any amount of data, but the important thing is the pathological cases. You have how good your data set from the pathological point of view, that will decide the efficiency of the machine learning based method or the deep learning based method for the classification task. And I would like to mention that especially the machine learning and deep learning under this big umbrella of artificial intelligence has been extensively used in the other speech processing tasks like speech recognition for a healthy subjects, where the performance of that speech recognition system is comparable to that of humans. For example, that is why we have in-car entertainment system with advanced car models where you can directly speak into those modules which will do the specific action. Or you might have seen the advertisement for Amazon Alexa home entertainment system like that, and even business transactions you can do. For the regular purpose, this deep learning and machine learning models have shown very good performance, which shows that there is a potential of using this ML and deep learning for voice pathology detection tasks. Only issue here is when I go for the conventional tasks like speech recognition, speaker recognition, speech synthesis, from a healthy subjects, I can collect millions of data points. That is a limitation in the case of voice pathology, where if you have enough data, relatively may not be that much big, at least you have decent amount of data, we'll be able to build good ML and DL based speech pathology, voice pathology detection. Let me summarize. I briefly introduced the terminologies in the field of artificial intelligence, machine learning, pattern recognition, deep learning. I listed some of the machine learning models, listed some of the deep learning models. I mentioned the distinction between machine learning versus deep learning and how machine learning can be used for voice pathology detection that I briefly mentioned. So with this, let me conclude. Thank you very much. I'll stop my presentation. If you have any questions, I'll be very happy to take the questions.
I thank Dr. Mahadev Prasanna for his enlightening talk on artificial intelligence, concepts of machine learning and deep learning and pattern recognition, and for his immense and rich ideas on speech signal processing and its relevance in voice pathologies. Now, moving on to the session by Dr. Vijayalakshmi Subramaniam.
Yeah.
Dr. Vijayalakshmi Subramaniam completed her DLO from Kasturba Medical College, Mangalore, Manipal Academy of Higher Education in 2002, followed by DNB in 2004 from the Ministry of Health and Family Welfare, Government of India, New Delhi. She has a postgraduate diploma in bioethics and medical ethics, as well as a postgraduate diploma in clinical ethics from Yenepoya deemed to be university. She is a Feimer Fellow awarded from PhD at the Feimer Regional Institute, which is a leading center in the area of faculty development and curricular transactions with respect to medical education. She specialized in otology, micro-ear surgeries, endoscopic sinus surgery, microlaryngeal surgery, general ENT, medical education, curriculum development, e-learning, biomedical ethics, and clinical ethics is a special area of interest. She is a member of Music Therapy Association of India. She is a prominent faculty in advocating musical therapy for various cognitive communicative disorders like dementia and neurodevelopmental disorders like ADHD and autism spectrum disorders. She has more than 268 citations and an H-index of 7 and I-10 index of 5, with more than 38 research projects at the national and international levels. She mentors and guides PhD and PG medical students in the field of ENT and audiology and speech language pathology. Currently, she serves as a professor and the head of the Department of OTORHINOLARYNGOLOgy at Yenepoya Medical College Hospital. We are pleased to have to invite her for the first session on clinical laryngeal examination. Over to you.
Thank you very much, Aishwarya. And before I begin my talk, Dr. Ajish Abraham has just logged in, so I would like to formally welcome him for today's sessions as part of this workshop. And in the beginning, I did not notice that Dr. Jayashree Bhatt had joined us, so I missed welcoming her. So it is my pleasure to welcome my teacher. It is also my proud privilege to have her amidst us today. Dr. Jayashree Bhatt, who was formerly the head of the Department of Audiology, Speech Language Pathology at the Kasturba Medical College, Mangalore. I am very happy to say that she is now very much part of our Yenepoya family. She has just joined us last week as a member of the Department of the Audiology and Speech Language Pathology. And thank you so much, ma'am, for joining this workshop. And it is I'm really happy that we'll all be getting more opportunities to learn from Jayashree madam. So my session is on the clinical evaluation of voice. I'll be just sharing my screen in a moment, and I would request one of you to please confirm if you're able to see my slides. So are my slides visible?
Yes, ma'am.
Okay.
Yes, ma'am.
Thank you very much. So before I go into the session, once again, I would like to greet all of you on this occasion of the World Voice Day. And although this, the slogan here says, love your voice, I'm sure there's nobody who doesn't like their voice. All of us love our voice, and all of us want to have a voice that is apt for the occasion, and all of us want to voice our thoughts and opinions. And we are really blessed that we have a voice in today's world, and we are able to share our thoughts, opinions, and feelings with others. Now, our voice is so unique, although the books of science say that there are only 5 special senses, that is vision, hearing, smell, taste, and touch. I would classify voice as the 6th sense because it's a unique capability that human beings have, and which helps us communicate our thoughts, feelings, and emotions. And it gives us our identity and our personality. Now, having said this, the voice is dynamic and it changes throughout our lives, right from birth till we become old. And We also are capable of modifying our voice to suit the occasion and the suit the thought or the emotion that we are, trying to express. Now, before we actually go into the clinical evaluation of voice, let us just have, discuss the characteristics of normal voice. It's actually very difficult to define what is a normal voice, but generally, a normal voice is something that is clear, it is audible enough, in the sense the intensity is as much so that it is audible to the other person who is listening, and it's stable in the sense even if we have to speak in different ranges of acoustic settings, the voice is stable. Stability of voice is definitely a very, very, very important for the professional voice users. And we need to have a voice that is appropriate for age and the gender. The voice should be capable of fulfilling the various linguistic and paralinguistic functions. So we should be able to modify our voice depending upon the language in which we are trying to communicate. And the voice should not, a normal voice will not fatigue easily, and there will be no pain or discomfort while we are, phonating. So, having a voice, good voice quality is extremely important, because only then the message that is being communicated will reach out to the audience that we are trying to communicate. Now, if we look at our school or college days, we will be able to recall that there were certain voices that were able to captivate us and capture our attention. It may be our teacher, it may be the mother's voice, it may be the celebrities. And I don't think there is anyone who has not been captivated by the voice of Big B, or the voice of Lata Mangeshkar, or the voice of M.S. Subbulakshmi Amma. And today, all of us from anywhere, we can recognize the voice of our Prime Minister, because that voice has all the characteristics which can capture our attention. And there are voices which can actually stir certain emotions. For a professional voice user, it is very essential that they have a good voice that is capable of capturing attention. So, having said what a normal voice is and what could be the characteristics of what we call as a normal voice, if there is a change in the quality or the pitch or the loudness of the voice, those voices fall in the category of disordered voice. Now, more often, patients who come to us for a voice problem, they come to us because they have some form of problem either with the quality or the pitch or the loudness, and this could cause significant impairment to whatever work they are doing. And that impairment or impediment could be due to a structural problem within the vocal apparatus, or for professional voice users, it could cause limitation in their activity. So they'll not be able to, use their voice across, singing across different octaves. So what happens is the range of voice is reduced, or the voice can tire easily. So they seek attention because they have limitation in performing their routine activities which require the use of their voice. Further, patients who have disordered voices, particularly professional voice users, will not be able to participate in the activities like singing as part of a group choir, or as solo performances, or those who give vocal support for various recordings. They will their participation in these activities may get restricted, and what happens is they face consequences which has a significant impact on their mind. Of course, apart from that, it also affects them in their social interactions. It also affects the occupation that they are performing. Even teachers, significantly, they are not able to perform if they have a disordered voice. It can also have financial implications, and over all these things can also contribute to physical problems as well. So just a small note about the prevalence of voice disorders. Studies have shown that 21.4% of adult population present with voice related disorders, and commonest of this is shown to be functional dysphonia, followed by laryngopharyngeal reflux disease, and then vocal nodules and vocal polyps. So from this statistics, we are able to understand that there is a significant adult population which is seeking help for voice disorders, and the prevalence of voice disorders is higher among professional voice users. So how do we go in to identify the cause for a voice disorder? So all of us are aware that there are three elements which are responsible for production of a good voice. One is the energy source, which is provided by our lungs. The next is the vibrating structure, that is the vocal cords. And the third is the resonators. So it is to have a good voice quality, to have the pitch and the in the loudness of the voice, it is important that all these elements are functioning normally. So only if we have proper lung capacity and the lungs are not affected by any pathology, the energy will be provided by the lungs to for the vibration of the vocal folds. So for having a good voice, it is essential that the energy source or the lungs are functioning well, and they do not also have a structural abnormality. And then the source of the voice is the vibration. So the vocal cords should not have any pathology that is affecting either their structure or their vibratory capacity. And then the resonators, the vocal tract, which modulates the various the sounds into the various vowels and consonants, and gives the characteristic resonance to the voice, which gives the timbre for the voice, and which helps us to produce the recognizable speech and singing voice tones, should be intact. Now, each of these elements can have pathological processes. So we need to look if there is any structural abnormality, which or a neoplastic abnormality. So the neoplastic abnormality, as all of us know, which could be either benign or malignant, or there could be an inflammatory process, which could either be infective or non-infective. There could be some form of neuromuscular dysfunction, which could be the hyperfunction or hypofunction, combination of hyper and hyperfunction, or there can be issues with control and coordination. The fourth pathological process which can affect the voice is muscle tension imbalance, which could be either primary or secondary. So when we look into these aspects, we should also get an understanding of what primary or secondary factors or contributory factors are there which affect the voice quality. So the patient's complaint may not be part of these contributing factors, but it is very essential for us to ascertain what these factors are and how they could affect the voice quality. It could be the general physique of the individual. They are, poorly built, poorly nourished. These could affect the voice faculty, so the voice quality. Then it could be the psychological factors which could affect voice quality. So there are a lot of, there are some people who are extremely stressed, extremely anxious, and these are things which could be the contributory factors which are affecting the voice quality. So the evaluation of a client who comes to us for seeking help begins as the client enters our outpatient facility. So as the client walks in itself, we will be able to look at whether the client is breathing properly, whether the breathing is more effortful, whether there is some when the client starts talking, you will be able to understand a lot on the processes that are happening, and you will be able to identify what pathological process is probably going on with the client who's seeking help. So every assessment has to begin with a complete history. So as the client starts communicating to you and expressing what problem he or she is facing, our assessment begins when we listen to the voice, and we are able to see if the client is able to speak across a reasonable range, the ease at which the client is able to use the voice, the volume of the voice, and we'll also be able to get an understanding of the quality of the voice. Now, let us go into the pertinent issues that we will be able to address with a proper history taking. So when we get a history, when we get the chief complaints, the client could present to us with hoarseness of voice, with an abnormal pitch in the voice, or it could be the strength of the voice which is affected, or it could be a wavering in the voice. So when we take a detailed history of each of the presenting complaints, we need to understand what is the duration of these complaints, whether it is of acute onset or chronic onset, and what is the duration that is passed ever since the symptoms started, and also, of course, the treatment history, and what are the factors which are probably contributing to the problem. It could be overuse of voice, it could be the misuse of voice, it could be some external injury, exposure to certain fumes, it could be a simple common cold, it could be hormonal imbalances, hormone therapy, as I said earlier, psychological factors such as stress, it could be even surgeries, and we need to actually get a history of what actually aggravates the problem. And if there'll be clients who come to say that my voice is worse when I wake up in the morning, but through the day, as I use my voice, the voice improves and I have a better voice towards the end of the day. There could be a client who's saying it's vice versa too. So what are the aggravating factors? What are the relieving factors? These are the issues that we need to get an understanding of when we take a history of the presenting complaint. We should also see there, check if the client has any form of laryngopharyngeal reflux disease. So we need to understand here that most clients, if you directly seek a history saying, do you have heartburn? Do you have any symptoms of acidity? They will deny. So we need to use certain questionnaires, things like the reflux symptom index scoring, to understand really if there is the laryngopharyngeal reflux disease which is contributing to the voice problem. Get a history of throat pain. Also take a history of respiratory difficulties, whether the patient is having shortness of breath, and whether the shortness of breath is exacerbated at it's with exertion, whether there is any history of wheeze, whether there is any snoring, whether there is any noise, any other noise that is generated while breathing. Then we need to take history and understand if the client has any history of neurological disorders. Most we see that patients with Parkinson's disease or other neurological disorders do have issues with the voice. Any previous history of psychological disorders for which the patient has been treated either by psychotherapy or by pharmacotherapy. So most clients who've not been treated with drugs for their psychological issues will deny that they have had any psychological disorder, who've just been counseled. But getting to the problem is very important, and it's a very important component of our history. Also, a history of endocrine disorders, particularly the thyroid gland, is essential to get. Now, of course, as part of our demographic data, we will be asking what occupation the client is performing. But the client could be a teacher, singer, a tour guide, an announcer, a telephone operator, could be a restaurant employee, could be a nursery school teacher, or could be engaged with karaoke singing as a hobby. But it's not just getting to know what is the occupation. We need to also ask for how many, what is the duration in a day where the client is using the voice, and how often the client is overusing the voice. Nursery teachers, singers, especially, there'll be situations when they have to really overuse their voice, use it at a very high intensity, loud singing. So these are karaoke singing, again, very, very important, because when a client sings on a track, they will be not singing at their own pitch, but will have to accommodate to the pitch of the original track. So these are things which we will have to ask. History of taking any kind of medication, psychotropic drugs, any hormones, antihypertensive, particularly the ACE inhibitors, we will have to ask, because they do contribute to dry cough and hence change in the voice. Habits, particularly smoking, have exposure to, not just smoking, exposure to smoke. So those who use, women in the rural areas who use the traditional chulha or firewood for cooking. So that is one of the important history that we have to take. Smokers, and of course alcoholics. Alcohol contributes to reflux, laryngopharyngeal reflux, and history of drug allergies or any other allergies is very important to acquire. Now, when we take a detailed history, we need to understand the nature and the chronology of the voice problem with which the client is presented. As I said earlier, the exacerbating factors and the relieving factors, the lifestyle, the dietary issues, and hydration issues. So keeping the vocal cords lubricated, continuous hydration is again a very important factor which contributes to a good voice. If the client is on any treatment for any medical conditions or any medical condition that could probably contribute to the voice, asthma, we already talked about neurological issues, we talked about hypertension, cardiac issues can also contribute to the impairment of voice, and the history of what is the purpose where the client puts the voice to use, the occupation, and what are the demands of that particular occupation in terms of voice usage. Then what is the impact of the problem on the quality of life and the social and the psychological well-being of the client. So why we need to understand this? Because we need to adapt a holistic approach when towards the management of the problem with which the client has presented to us. We also need to understand the expectations with which the client has come to us for consultation. A singer may say that I need to have my voice back by tomorrow because I have a concert. A politician may say tomorrow I have an election campaign and I have to use my voice. So we need to understand their expectations. So what kind of requirement that they want and what outcome they want out of the consultation and treatment that we are going to offer. The patients, we need to have an understanding of the patient's complaints that are related to the changes in the voice quality, whether it is hoarseness, whether it is roughness or breathiness. Whether there is a pitch that is too high or too low, and whether it is which is not appropriate for the age and the gender, and the ability to control the voice as required. So whether the client has the ability to control the voice, or there are breaks in the pitch, or the voice is just cutting out. Singers will often say as they raise their voice, the voice is cutting out. Teachers will also say this as they multiple classes, continuous hours of lecturing, the lecturers will say suddenly there is a break, there is a cutting out of the voice. Inability to raise the voice in a noisy environment. They're not able to because there's a ambient noise and they need to ensure that they are heard, but they are not able to raise the voice. And increased effort required for the use of the voice, or reduced stamina, that is fatigability. One tires when the voice is used. As I said earlier, there will be clients who present that I'm okay in the morning, but as I use my voice by evening, within a span of an hour or two of using my voice, I'm tired, or by end of day, I'm left with no voice. So what are the difficulties or restrictions in the use of voice at different times of the day, and how they are related to the specific work or specific work-related tasks which the client is performing on a day-to-day basis? And does the voice change impair their ability to communicate effectively? Is there a difficulty in singing? And what are the other throat-related symptoms? Sore throat, pain in the throat, discomfort in the throat, dryness of the throat, and mucus. So what are the other throat-related symptoms which are related to the voice use? And what is the consequences, especially the emotional and psychological impact of whatever we discussed till now? So when we get a history of other throat symptoms, what we usually need to ask for is any discomfort in the surrounding areas of the larynx, or any pain, any soreness or burning, or any kind of tickling sensation in the throat, any sensation of lump in the throat, or a feeling of something getting stuck in the throat, a feeling of being strangulated, dryness of the throat, mucus in the throat, a need to clear the throat. So many of us miss getting this history because patients usually have a postnasal discharge, and that gets unnoticed, and they often clear their throat. So those who clear their throat frequently are more prone for voice disorders, and we need to ask whether there is a frequent need to clear the throat. Is there any irritating cough? Do they have any choking episodes, and is there any difficulty with swallowing? A detailed history should always be followed up with a comprehensive clinical examination. So when we begin our clinical examination, it begins with the general physical examination where we check the height and the weight of the patient, and so we are able to calculate the body mass index. So a person who has a very poor body mass index, very poorly nourished or poor built will usually have a weaker voice. The obese individual will also have issues with their voice because they will not be able to use their voice as effectively. So we need to understand whether our patient has got an adequate weight for the height and is nourished well. So we also need to evaluate for anemia and signs of allergy on the general physical examination. And following this comes our systemic examination where we will do the cardiovascular examination. And very important examination is the respiratory system examination, because as we said earlier, the power for the voice is the respiratory system, the lungs. So I will give you the points that we need to look at when we do the respiratory system examination. Of course, the neurological evaluation is very, very important. So we need to also examine the cranial nerves in detail, and of course the abdomen examination, because we need to, when we do a systemic examination, we need to rule out all other problems which could be contributing to the voice issue. This will be followed by a complete ENT evaluation. So we need to examine the ear, do a complete otoscopic examination, and also assess the hearing acuity, which we usually clinically we do the tuning fork test, and then assess the nasal airway patency. On anterior rhinoscopy, look for edema of the nasal mucosa, any features of allergy in the nose, any structural abnormality in the nose, such as a deviated nasal septum or any mass lesion, which could be a neoplastic lesion or a non-neoplastic lesion, such as nasal polyposis in the nose. Examine the oral cavity for enlargement of the tonsils or enlargement of the pharyngeal lymphoid tissue. As we do this examination, we should note the amount and viscosity of the mucosal and the salivary secretions. A very important aspect that we need to look for is the scalloping on the lateral aspect of the tongue, which is usually seen in muzzle, which is a feature of muzzle tension dysphonia. Dental evaluation. If we see marks of bruxism, we'll understand that is also contributing to the voice problem. And of course, edentulous patients or partially edentulous patients will have issues with their voice. We need to examine the neck for masses, particularly the thyroid and other masses as well, lymph nodes, and we need to examine the neck movements. So any painful neck movements can also affect the voice. So neck muscle spasm, cervical spondylosis again can be contributory to a voice problem. Now, as I said, assessment of respiration. We need to observe the respiratory pattern and understand whether the client has abdominal breathing, thoracic pattern of breathing, clavicular pattern of breathing, or a combination of these. We need to look at the coordination of respiration with phonation. If the client has breath holding patterns, so if the client is when the client is talking to you, if the client suddenly does this or suddenly puffs and then continues talking, so that is again a sign of a problem. Now, habitual use of residual air and the length of the breath is something we need to assess. And of course, the speech language pathologists present here will know this very well. So you need to assess the maximum phonation duration and the Serzer ratio to assess for the glottal insufficiency. So Serzer ratio will may indicate a pathology in the larynx. Now, the various methods of laryngeal examination include indirect laryngoscopy. So that's done using a laryngeal mirror. Then the 70-degree or the 90-degree rigid video laryngoscopy, where a 70-degree or a 90-degree rigid telescope is employed attached to a video camera for examining the interior of the larynx and the laryngopharynx. Another method is the flexible fiber optic nasopharyngeal and the gold standard, of course, for examining the movements of the vocal cord is video stroboscopy. Now, here you see a mirror examination of the larynx being done. The structures seen during indirect laryngoscopy are described in the adjacent diagram. So the structures usually visualized are the base of tongue and the circumvallate papillae, and then the median glossoepiglottic fold, the lateral glossoepiglottic fold, the vallecula on either side of the median glossoepiglottic fold, the epiglottis, the false vocal cords, the true cords, the arytenoids, the aryepiglottic folds, the retroarytenoid region, and sometimes we can also see the tracheal rings, the subglottic area on indirect laryngoscopy. And of course, we need to see the anterior commissure. So when we do an indirect laryngoscopic examination, if you're not able to see the anterior commissure, we need to just give pressure on the thyroid cartilage so that we are able to push the larynx and visualize the anterior commissure. And of course, we will be able to see parts of the laryngopharynx, particularly the piriform sinuses, sometimes even the postcricoid area. So here we are seeing actually this is the picture here is of a video laryngoscopy, but the parts that are visualized, this is exactly how we see even when we see the indirect laryngoscopy using a mirror. So we need to remember that we are seeing a mirror image of the larynx when we do a indirect laryngoscopy. Through our indirect laryngoscopy and also the rigid endoscopy that is done using the 70-degree or the 90-degree video laryngoscope, we will be able to visualize these same structures, and we need to look for nodules or mass lesions in the larynx, contact ulcers, hemorrhage in the larynx, any hemangioma in the vocal cords or in the subglottic area, erythema or congestion of the vocal cords, which is sign of inflammation. Movements of the vocal cords will help us understand whether there is a paresis or a paralysis of the vocal cord. Will also be arytenoid, the erythema or congestion of the arytenoid is a sign of reflux laryngitis. We'll also be able to see erythema and edema of the laryngeal surface of the epiglottis and also look for other anatomical abnormalities. Now here we see a flexible fiber optic nasopharyngoscopy, nasopharyngolaryngoscopy session. Now this gives us a direct image, not the indirect image which we see in the mirror laryngoscopy and the rigid 70-degree video laryngoscopy. And in the pediatric population especially, it is easier to perform a flexible fiber optic nasophryngolaryngoscopy to assess the abnormalities in the not just the larynx but also the nasopharynx and the nasal cavity as well. So when we examine the laryngeal interior, what are the key points that we need to look for? Of course, I have already said what are the structures we will see, but specific for a disordered voice, we need to look at the color of the vocal cords, the movements of the vocal cords, the surface of the vocal cords, and the edge of the vocal cords. So there we'll be able to, when we look at the surface and the edge of the vocal cords, we'll be able to identify any abnormality of the mucosal layer of the vocal cord, whether there is any structural abnormality or whether there is any contact ulcer or anything on the edge of the vocal cord. And of course, identify vocal cord paresis and paralysis by observing the movements of the vocal cord both during respiration and phonation. Then we need to look at the false vocal cords. Many a time we will find that the false vocal cords approximate before the true vocal cords, or the true vocal cords approximate, but the false vocal cords do not approximate completely. So we need to look at the false vocal cords for structure as well as the abnormality in the movement and the closure. And as I said, we need to look at the anterior commissure, because that is an area where we are likely to miss out the pathology. So when we're doing the indirect examination, if we are not able to see the the anterior commissure, we definitely need to give pressure on the front of the neck, on the thyroid cartilage, and push it a little above so that we can visualize the anterior commissure and look for any abnormality there. So the next is the video stroboscopy. Actually, you will be seeing a demonstration of video stroboscopy in the forthcoming sessions. This is the gold standard for investigation of a disordered voice, because we are able to actually see the movements of the vocal folds using flashes of light. So what this slide is showing actually what are the things that are normally looked for during video stroboscopy. That is, one is the amplitude of vocal fold displacement, the mucosal wave pattern, the vibratory behavior. So if there is any non-vibrating portion of the vocal fold, the supraglottic activity, the extent of laryngeal compression, the edge of the vocal fold, whether there is the roughness, the smoothness, we will be able to rate the smoothness, roughness, and the other straightness or irregularities of the vocal fold edges. The pattern of closure of the vocal folds at the vertical level, the face closure, the face symmetry, and the percentage of time with symmetry between the left and right vibratory faces, the regularity, the rating or the percentage of time with the regularity of vibration, and the pattern of glottal closure, the shape of the glottis at closure. So details of this will be demonstrated in the forthcoming sessions. So I'll not be getting into the details for today. Thank you very much for patient listening.
Thank you, ma'am, for your very informative session. Now I would like to introduce our guest for the second invited session. We have an eminent person in the field of electronics and electrical engineering who has steered the profession of audiology and speech-language pathology in India, a teacher of all our teachers. Dr. Ajish K. Abraham, professor in the Department of Electronics and the head from All India Institute of Speech and Hearing, Manasa Gangotri, Mysore. His area of interest in research includes design and development of biomedical instruments, audio and speech processing, research on hearing aid technology, acoustic noise, etc. He is serving as an editorial member and reviewer of several internationally reputed journals. Dr. Ajish K. Abraham is the member of many international affiliations. He has successfully completed his administrative responsibilities. He has authored many research articles, books related to design and development of biomedical instruments, audio and speech processing, research on hearing aid technology, acoustic noise, etc. He has pioneered distance learning education programs of All India Institute of Speech and Hearing before it became a trend in recent COVID pandemic times. He has visited abroad as a resource person and as representative in multi-forums and sets as an icon and role model for all youngsters with his dedication and determination and commitment to the upliftment of persons with disabilities by enabling them through technology. I kindly request you to take over, sir.
Good afternoon, all of you, and thank you for the nice introduction. First, let me share my presentation. Is my presentation visible?
Yes, sir.
Okay.
Yes.
Yes, sir.
So thank you for this opportunity to be a part of this program. I should thank Dr. Vijayalakshmi, Dr. Sheetal, and my student Hemraja for making me a part of this program. And the topic which is given to me is to speak on the role of acoustic methods. So, and specifically, the organizers have told me to concentrate on three major aspects of the acoustic analysis. First is the criteria for a good quality recording, then the methods for calibrating the sound level measures in the voice clinic, and third point is on the reliability and validity related to acoustic voice measures. So I'm not sure whether I would be able to cover all the topics within the allocated time, because each of these topics have a lot of things to be told about, but I would try my level best to complete it in the given time. Now, we all use acoustic analysis as a part of the profession, and it has become an integral part of voice assessment. And always it should be highlighted that the perceptual analysis of voice by an experienced clinician, it can never be replaced by acoustic analysis. So acoustic analysis is just a supplement. It's only a new dimension to the voice evaluation, the perceptual evaluation, because it allows the clinician to have a quantifiable baseline for further follow-up. Now, when we do acoustic analysis, it really makes sense only when the recording procedures and the technology have no significant influence on their numerical or graphical output. Now, when I say this, naturally, all of you may think that now sound recording is very common. We can record our voices or messages or songs through our mobiles, which is available with all of us. So when we do that with such simple device, what is so complex or what is so critical in clinical recording? So here, I would like to stress on one point. When we do clinical recording, the samples have to be recorded without any pre-processing or post-processing. The samples which we record, we cannot do any processing to remove or eliminate or to compensate the changes in the recording because of the influence of the other factors. Whereas when we do recording for recording with our mobiles or with our laptops, we can do a lot of post-processing to compensate for the deficiencies in the recording media. So that is where the precision recording in clinical applications needs to be focused on. So it is important to first establish the complete recording system suitably before applying acoustic analysis methods. And when we talk about the diagnostic system specifically for assessment of voice disorders or speech disorders, they all operate on recorded voice samples. So the efficacy of these systems or the accuracy of the measurements performed by the systems or accuracy of the parameters which are extracted by these systems depends on how close the recorded voice is to the original voice or to the actual voice. And this degree of closeness is associated with the hardware and software systems which are involved in the recording process. Now, the acoustic characteristics are influenced by several factors. It is influenced by the recording conditions, the type of microphone, the system and software of analysis, the speech task, that is the stimuli which is presented, the algorithms involved, and the human interaction with the vocal laboratory. So we did a project a few years back to find out the factors which are influencing the closeness of the recorded speech samples to original speech, the results of which I would be presenting in this presentation. So like that, many international researchers have established the influence of several factors on the quality of recording of speech samples. And they have also compared the recordings obtained through different combination of devices. Okay. So even though wide research has been done in this area, there has been no consensus achieved which identifies the specific parameters those are getting altered. And also there is no consensus on whether the deviations in the parameters are following a strict pattern or a regular pattern. So now having said or having given an overview about the importance of a high quality voice or speech recording for voice evaluation in your clinic, let us see what should be the criteria to get a good quality recording. So now when we see the components of a voice recording system, so when you are recording the voice samples for analysis, the first device which comes in your way is the microphone. So without microphone, you cannot collect the sound or acquire the sound. Then after acquiring sound from the microphone, then comes the digital device. It can be your mobile, it can be your laptop, or it can be a dedicated recording device, digital recording device. And after the microphone gives the signal to the recording device, it is finally converted into an audio file and it is saved as an audio file in the computer. So all these components definitely influence the quality of the recording. So the microphone will influence, the digital audio capturing device will influence, the room acoustics and environmental noise, as well as the audio file format will influence the quality of recording. Okay, so one research says that the fundamental characteristics of sound influencing the accurate recording of voice and speech are mainly three. First one is the fundamental frequency. Second one is what you call as timbre, which we can call in some other way as the sound spectrum. And third one is the sound pressure level. And these three characteristics shall be ideally identical in the captured sound when you compare it with the original sound. So if there is a deviation in these characteristics, then we will say that the quality of recording is not good for analysis. So when I say deviation, it is the deviation because of the components of the recording system. So the accuracy of capturing these characteristics, the fundamental frequency, the sound spectrum, and sound pressure level, it depends on frequency response and dynamic range of the microphone. It depends on the mouth to microphone distance. It depends on the place in the room. So we will these factors one by one. The first factor is the microphone. Excuse me, some noise is coming. Can you please mute your microphones? Okay, thank you. So the purpose of the microphone, as we all know, is to convert the sound pressure signal to an electrical signal with the same characteristics. So when this conversion from the form of acoustic to electric happens, there should not be any change in the characteristics of the signal. Now, most of the microphones, they're not developed for the purpose of recording sound for analysis. Instead, they are developed for the purpose of recording sounds for music, sounds for stage performance, public address system, broadcasting, etc., etc., etc. So therefore, many of these microphones which are available are not suited for accurate measurements of voice and speech, but they are suited for the purpose which they have been designed, because as I've told in the introduction, when we record it for music, a lot of post-processing takes place. So if there is a deviation in any of the parameter while recording, we can correct it during that post-processing time. Whereas when we record samples for acoustic analysis, we cannot do post-processing because we are interested to find the deviation in parameters. Okay, so closely what we record should follow what is at the source, what is being spoken by the speaker. So when we consider the microphone, the ability to accurately transform the acoustic waves, that is the sound pressure waves, to electrical signal really matters. And these are the characteristics of the microphone which tells us about this ability: the frequency response, the distortion, weight of the moving elements, dynamic range, equivalent noise level, distance from the source, and signal to noise ratio. So we will quickly glance through these parameters and then we will see the other factors. So when I say frequency response, it is the output. It is a plot which shows the output of the microphone at different frequencies. So we know that the audio frequency range is from 20 hertz to 20,000 hertz. So how does the microphone responds to each of those frequencies? So a typical frequency response of a microphone is shown here. So as is evident from this curve, the response is not flat. If it was responding equally for all frequencies, you should have got a flat curve here, but the curve is with lot of ups and downs. So that means the microphone is not responding equally or in the same way to all the frequencies. Now from this frequency response, we take two things. What is it? One is the low frequency limit. So low frequency limit is the lowest frequency which the microphone is able to respond. So when we select a microphone for our recording for analysis, we should make sure that the low frequency limit of the microphone shall be lower than the lowest produced fundamental frequency of the voice. So for example, when you see this plot, if you see the low frequency limit of this microphone, it is somewhere here, somewhere around 100 hertz. Below 100 hertz, the output is coming down. So therefore, if I have to use this microphone, I have to make sure that the lowest fundamental frequency of voice is above 100 hertz. If the fundamental frequency is less than 100 hertz, I will not be able to use this microphone. Then we have an upper frequency limit also. The upper frequency limit of the microphone for a good recording shall be as high as the highest spectral frequency of interest. So when we consider the speech frequencies, we consider that up to 8 kilohertz, if we get, that is as per the ANSI standards, up to 8 kilohertz, if the microphone is able to perform well, then the microphone is good for a recording. Now the frequency response of the microphone between the low frequency limit and the upper frequency limit. So if you see this curve, the deviation should not be more than 2 dB. Okay, so then we will be able to get a good quality recording. The second important aspect of the microphone is the distortion. So most of us confuse distortion with noise. Now distortion is totally different from noise. Distortion is the ability of the microphone to reproduce the waveform as it is. So if you see the picture here on the upper frame and the lower frame, you feel that there is some difference in the wave shape here. Okay? Both of these are recorded for the sound ta, the initial portion of the sound ta. This is with a good quality microphone. The upper one is with a good quality microphone, and the lower one is with a little lower quality microphone. So you can see that the wave shape has totally changed. This is distortion. The change in wave shape which is produced by the microphone is called distortion. The next important factor is the weight of the moving element. So when we use microphones for recording, most of the microphones which are used for recording are moving coil microphones. We call them as dynamic microphones. So in these microphones, there is a voice coil here, which is attached to the diaphragm. So when sound falls on the diaphragm moves. Along with that, this voice coil moves, which is proportionally converted to an electrical signal. Now, if you see the waveforms here, the pictures here, all are for the sound ta. Now, if you see this point, you can clearly see the burst of the stop consonant ta, whereas here the amplitude of the burst is very less. And when it comes to this, the amplitude is again less. When it comes to this, the amplitude is again less. So these have been recorded with 4 different microphones, which vary in the weight of the moving element. So weight of the moving element has to be less to accurately pick up transient events, or the events which happen in very less duration in speech sound, especially in stop consonants. Bursts are typical examples of the sound. So this is another waveform which shows the influence of the weight of the moving element. So in this waveform, the burst is not at all visible, whereas it is clearly visible here. The next parameter which influences the performance of the microphone is the dynamic range. We are all familiar with the dynamic range of hearing, or the dynamic range of a hearing aid. So when we consider the recording for speech, the highest level is limited by the movement of the diaphragm. So when sound falls on the diaphragm of the microphone, the diaphragm responds to the pressure changes, and it is this response of the pressure changes of the diaphragm which is converted into equivalent electrical signal. So the highest level which the microphone can respond, the highest sound level which the microphone can respond, depends on this. So as you see here, I have the highest sound levels for different microphones. So for this particular microphone, the highest level is 140 dB, whereas for this particular microphone, the highest level is 190 dB. So similarly, there is a lowest level which the microphone can respond, and this level is limited by the thermal noise of the microphone. Now, when we consider a microphone, the microphone has got a diaphragm which is exposed to air. Even when no sound is falling on the microphone, the presence of air around the microphone can cause the diaphragm to move, can move the diaphragm, and this can result in an electrical signal. So that means when there is no sound also, the microphone is giving an electrical signal. And this is because of the movement of air around the microphone, which is displacing the diaphragm. Okay, so this signal, which is at the output of the microphone, if we convert it into an equivalent noise, we will get the equivalent input noise level. So the equivalent input noise level is the output produced by the microphone when there is no sound. So this equivalent input noise level, if you have to have a good recording, quality recording, it has to be at least 15 dB below the sound pressure level of the softest produced voice. So for example, if you are picking up a voice at say 45 dB or 50 dB, the equivalent input noise level of the microphone should be 15 dB down. So if the voice level, the softest level of the voice is 50 dB, 50 minus 15, the equivalent input noise level should be less than 35 dB. Another important factor which controls the quality of microphone is the distance from the source. So in most of our research, what we think is that if the microphone is kept at a distance of 10 centimeter, then everything is perfect. Okay, so it is correct that for certain microphones, the distance of 10 centimeter is correct, but this distance is dependent on the directional response of the microphone. Now, this is just an example to tell you about the importance of this distance. Now, if I keep a microphone 30 centimeter away from the mouth, then I'm going to get sounds from 30 dB to 120 dB. But if I keep the microphone at a distance of 5 centimeter from the mouth, this 30 dB goes increases to 45 dB, and this 120 dB increases to 135 dB. Okay. So this is the difference for a distance of 25 centimeters. So therefore, the distance at which the microphone is kept is a very important factor, but this distance is dependent on the directional response of the microphone. So you know that we have omnidirectional microphone which responds to sounds from all the direction. We have unidirectional microphones which responds to sound only from one direction. So for omnidirectional and unidirectional microphone, the 10 centimeter distance which we are following is correct. Whereas if it comes to specific directional microphone like bidirectional microphone or polar response microphone, the distance of 10 centimeter may not be standing good. This distance at which the microphone should be kept for recording is given in the microphone specification. So before you finalize the distance, don't take it as a blind criteria that it should be always 10 centimeter. Okay, it may differ from microphone to microphone depending on the response of the microphone. The next important criteria of the microphone is the signal to noise ratio, and all of us are familiar with this term of signal to noise ratio, which is just the difference between the average sound intensity level and the average noise level. So subtract the noise level from the signal level, you will get the signal to noise ratio. Now, what should be the ideal signal to noise ratio at which I would be recording? So there are studies on the thresholds of signal to noise ratio, and according to Deliski 2005, they say that a signal to noise ratio of greater than 42 dB is recommended for very high quality recording to keep the error in measurement very low. Okay? And the study also says that if your signal to noise ratio is above 30 dB, then it is acceptable recording. So 42 dB is good quality recording, whereas signal to noise ratio of 30 dB and above is acceptable recording. Now, when we consider signal to noise ratio, we should be aware of two different terminologies in signal to noise ratio. One is the speech to noise ratio, and second one is the voice to noise ratio. So speech to noise ratio is a measure of the difference in intensity level between concatenations of all sounding segments. So now if you see this waveform, you have a sounding segment here, you have another sounding segment here, and you have a gap in between, you have a silence in between. Okay? So when we take the level of speech to find the speech to noise ratio, we should take this and we should take this portion and add and then take the average for that. Okay, so a sounding speech segment is defined as a part that for at least 0.05 seconds is louder than 25 dB below the loudest intensity level of the sound. So in this example, if you consider this as the loudest intensity, anything which is within 25 dB of the loudest intensity, you can consider as speech. So you concatenate. Concatenate means you add together or you sum together all those portions, net together all those portions, and then take the average. Then you will get the average level of speech. Similarly, we have to find the noise segment also. A silent or noise segment is defined as a part that for at least 0.03 seconds is softer than 25 dB below the loudest intensity level of the sounds. Okay, so anything which is within 25 dB of the loudest intensity, you will take as speech, and anything which is below 25 dB, you take as noise. Similarly, when we consider the voice to noise ratio also, what should we consider as the voiced segment and what should we consider as the silent segment? So when you take the voice segment, it is defined as a sound with minimum of fundamental frequency 60 hertz and maximum of fundamental frequency 1200 hertz. If you see this particular example, this is for the sound bar. You can see that the fundamental frequency is 225.9 hertz during this voicing part. Okay, so this part can be taken as a voiced segment, whereas this part cannot be taken as a voiced segment. Okay, so when you take the voice to noise ratio, it is the difference between the average voice level to the noise level. So we have seen the first component of a component which influences the quality of voice speech recording, that is microphone. Now we move on to the second important component, that is the audio capturing device, the digital audio capturing device. And when we consider the device which we use for recording, let it be our laptop, let it be a dedicated recording device, or let it be a mobile phone, we have to consider two major parameters. One is called the bit resolution. Usually when we publish our research findings, always we will have a statement like this, like the sampling frequency was 44.1 kilohertz with 8-bit quantization. So this 44.1 kilohertz is the sampling rate which is reflected in this research paper, and 8-bit quantization is the bit resolution. Another way of representing this is like this. It was sampled at 44.1 kilohertz, bracket in bracket 16 bit. So this 16 bit shows the bit resolution. Now, naturally, you will ask a question, which bit resolution is good? So if that question is answered in a proper way, I have to say that the higher bit resolution is the better. But when we go for higher bit resolutions, the cost of the recording device will increase. I can do a 16-bit recording with a laptop, whereas I cannot do 16-bit recording with a mobile device. I can do 32-bit or 64-bit recording with a digital recorder, where the cost of the recorder will be very high. So the bit resolution really depends on the complexity of the device, and as the bit resolution goes high, the cost of the device will increase. So somewhere you have to draw a break even. The next important component in the chain of recording is, first we consider the microphone, then we consider the recording device, and the last part of the recording component is the audio file format. After we record the speech sample or voice sample, it has to be saved in your recording device. So when you save, you have different file formats available in which it can be saved. So usually we are familiar with the WAV format. We are also familiar with the FLAC format. We are also familiar with the formats like MP3 and all. Now we have to be very, very careful in selecting these formats. However good is our recording system, the format in which the files are saved are also very important. So the WAV format which we usually use is an uncompressed audio format. Uncompressed means when we store it in this particular format, no information contained in the speech signal is lost. Okay, so that is why the .wav format is a preferable format for storing the audio files. Whereas when it comes to MP3 format, it is a format with lossy compression. That means when you are compressing the data, you are missing something. You are going to miss some important information. Okay, so MP3 formats are not suitable for the voice recording. You should stick on to WAV format or any other uncompressed audio format. Now the next factor, so now we considered the factors related to microphone, we considered the factors related to the recording device, we considered the factors related to the file format. Now all these are concerned with the devices in the recording system. There is another important factor which is controlling all this, that is the environment in which the recording is done. And it doesn't require any introduction to an audiologist or speech language pathologist to speak about the importance of the recording environment. The room acoustics and the environmental noise influence or interfere with the integrity of the voice signal itself. There are several studies which shows that. So this means that when we record the voice or speech signals, they should be recorded in as quiet an environment as possible. The clinician should strive for environments which are minimally contaminated by the reverberation or airborne noise or structure-borne noise. Now, the acoustic as a golden rule or as a standard criteria, you can consider that the acoustic noise in the room should be at least 15 dB below the sound pressure level of the softest produced voice. So again, if we assume that the softest produced voice which we are going to record is say 40 dB, the acoustic noise in the room should be 40 minus 15, that is 25 dB. So if it is about 25 dB, it is going to interfere with the recorded voice. Similarly, the reverberation time. You know that the reverberation time is the time duration for which sound prolongs in the room or sound continues to be present in the room. Okay. And the reverberation time is the time in which the intensity level of a particular sound drops by 60 dB in that particular room. So the reverberation time for recording purpose should not exceed 1 second as per the research done by Everest 1989. The longer reverberation times have to be avoided. So if it is above 1 second in your recording room, you can take other steps to reduce the reverberation time. Now, after having seen in detail the criteria for high quality voice recording with each and every device in the recording chain and also with the background noise or the environment in which the recording is done. Now let us move on to the method for calibrating sound level measures in voice cleaning. Now, once you have a good recording system with all the characteristics which we have seen till now in the presentation intact, it is very crucial to measure it as correctly or reliably as possible. Okay? And this is essential when we are going to compare the sound recordings within and across speakers and the sound recordings across clinics. So the differences in sound sensitivity between microphones and hardware as well as software input levels, they induce undesired variation in measured sound intensity. So when we use sound intensities to be compared between two speakers, we want that no other factor other than the factor which is influenced by the speaker should influence the characteristics. But when we do that, if there is a difference in sound sensitivity between the microphone used for patient A and the microphone used for patient B, then it is going to create errors which will not give us accurate data, and this leads to inaccurate analysis also. So therefore, we have to have a way of reliable measurement, a standard for reliable or a standardized measurement. So this paper, March 2011, has established that it is very crucial to calibrate the clinical intensity measurement before recording and analyzing sounds. Okay. And there are very complex ways for calibrating the voice level of your recording system. I will not go into the details of that because those complex systems or the complex methods require several equipments for calibration, which will not be affordable to many of us. So I will give you a simple method which is used for calibration. If you have a Pratt in your system, you can use this method for calibration. And this method has been forwarded by Marine et al. 2015. Okay, so what they say is you open Pratt, record the voice, and then there is a script written by these people, which runs through, which is a Pratt script, which runs through this waveform, which detects, extracts, and concatenates the voice segment. So when you use that script, you will get the signal level of voice or the voice level. Now, once you have the voice level, then you record noise. Noise can be the background noise in the room. Noise means the noise which is without sound. Now, when you are recording the voice, what should be your speech stimuli? So the two sentences, the second and third sentence of our famous rainbow passage is used for that. And once you record that, you run the Pratt script and get the signal level. Then you record noise, again run the same Pratt script, get the intensity of noise. And then after getting the intensity of signal and noise, you can just subtract the noise level from the signal level. So you will get some value. If that value is less than 30 dB, then you should not record the voice samples with that system. It is unacceptable. If your value, the SN ratio, the speech to noise ratio, which you get using this method is greater than 30 dB, it is acceptable and accurate. And if it is above 42 dB, then it is very accurate. Okay, so what you have to make sure is that it should be at least above 30 dB so that you can say that you're going to have a quality recording. So this method of calibration can be effectively used without any additional tools. The last point is about the reliability and validity related to acoustic voice measures. So when we consider voice is a quasi-periodic signal. You know that what do you mean by a periodic signal is a signal which is repeating. A pure tone is a periodic signal. A pure tone of 500 hertz is a periodic signal because it is the same waveform which will be repeating once in every 500 seconds if the pure tone is of frequency 500 hertz. It's a purely periodic signal. But when we consider voice is not a fully periodic signal. It is a quasi-periodic signal. For some portion it will be periodic, some portion it will not be periodic at all. Okay. So when in such quasi-periodic signals, when the signal gets buried in sufficient noise, it can be due to the hoarseness in the voice, it can be due to the roughness in the voice, or it can be due to the breathiness in the voice, then it is very difficult to extract information from such a signal to obtain a reliable analysis. So since voice is a quasi-periodic signal, we cannot use acoustic analysis for all types of voices. And there's a classic work done by Tixey in 1995 which suggests that of the 3 types of signals produced by voice, only 2 types will produce valid measures consistently in acoustic analysis. And they definitely say that if the samples are highly dysphonic, then you should not do acoustic analysis, because acoustic analysis will become, the results will become totally unreliable for highly dysphonic samples. So when you are concerned with the reliability and validity, this point should be there in your mind. Then the next important information you should keep in mind is that the information gathered from different software and systems are difficult to compare. So that is why we require the calibration measures, the calibration method, which I have demonstrated a few slides back. You check the signal to noise ratio and ensure that it is within that limit. Then you can have a quality recording. Then your recording becomes comparable with the recordings with the other systems. Otherwise, the type of the microphone system, the software, the speech task, the algorithms involved, and human interaction, they will all contribute to deviations in your measured values. Another important factor which you should keep in mind is about the comparison between the voices of persons of different age. So it has been clearly shown by several researchers that the measurements in the voices of adults are stable between 20 and 50 years of age. That means if the age of the person for whom you are recording voice is below 20 or if it is above 50, there can be variations in the voices, which has to be interpreted with caution. So when we compare the measured parameters, we have the normative databases, but these normative databases are for this particular range of age, that is from 20 to 50 years of age. So if you do not have a normative database for the age group which is less than 20 and for the age group which is above 50, you should not do the comparison with acoustic analysis. So this is also an important point you should keep in mind to have a reliable and valid, accurate acoustic voice measure. So to summarize what we covered today in this presentation is, first one, we saw the importance of, or we saw the significance of the components of the recording system on the, or the influence of the components of recording system on the voice quality. Then we took the recording system, the different components of the recording system. First one is the microphone, second one is the data capturing device, and the third one is the wave format. And above all these three, the environment in which the recording is being done. Then we saw the different characteristics of the microphone which are going to influence the recording. We saw about the frequency response. We saw about the weight of the moving element. Then we saw about the distortion, then the speech to noise ratio, distance of the microphone from the mouth of the person from which the recording is done, the influence of all this in the quality recording. Then we saw the influence of the recording device, where we have seen two parameters, the bit resolution and the sampling rate. Then we also saw the importance of the format in which the recording is being saved. So you always should save it in a lossless format. When you are saving it, the format has to be lossless. So always prefer lossless formats like .wav format. Then we also saw the influence of the environmental noise and the room acoustics on the recording. So you have to have a reverberation time of less than 1 second, and you have to have the recording done in a room which has got a noise level which is 15 dB down from the softest voice which you are going to record. Then we saw a method to calibrate the recording system or the system for the level measurement. Okay, so you record 2 sentences which are part of the rainbow passage, then run the SPRAT script to find out the signal level, then find out the noise level, reduce the noise level from the signal level, and if it is within, if it is above 30 dB, if the SNR is above 30 dB, then your system is calibrated, to have an accurate recording. And if you want still very accurate recordings, it has to be above 42 dB. Then we also saw the precautions we should have in mind when we do the acoustic voice measures for comparison of voice samples. It is influenced by so many factors. It is influenced by the age group. It is influenced by the system. So there are variations which has to be taken into consideration when you consider the reliability and validity. And these are my references. With this, I conclude this presentation. Thank you for the patient listening.
Thank you, sir. I thank Dr. Rajesh K. Abraham for his knowledgeable and most useful concept. With that, we are open for questions and answers from the audience. Kindly mail us at sitw.vd@gmail.com for individual response and queries and clarifications. With this, we would like to wind up the sessions for today. Day 1. Tomorrow for day 2, there are 2 sessions planned from 9 to 11 in the morning and from 2 to 4 in the afternoon. I extend my deep heartfelt gratitude for all the invited guests, delegates, and participants for showing their interest. We're overwhelmed with the interest expressed by the participants, irrespective of the long holidays and the season of festivals. It shows a great level of commitment to learning and patient care. Thank you, one and all. Chat box. So there are questions in the chat box, sir. Already answered.
Yeah, I'm doing that.
Yes.
There's one question. What is the preferred sampling frequency for recording? When you say preferred, that's not a scientific term. Either you have to say the ideal or optimal. So I would say the optimal sampling frequency for speech or voice analysis is about 22 kilohertz.
Thank you, sir, for your very informative session on voice analysis. If there are any more questions, kindly enter it in the chat box.